Hi everyone, I'm Jess with Restore First Health. We're an advanced mobile healthcare company. Today, we're talking about urinary tract infections, or UTIs, with one of our lead nurse practitioners, Jonathan Tibaldo. Jonathan, thanks so much for being here. Why don't you introduce yourself, and then let's start talking about UTIs.
Absolutely, Jessica. Thank you for having me today. My name is Jonathan Tibaldo, and I'm the lead nurse practitioner here at Restore First Health. I have come into Restore First Health to bring an acute care model, which that means like a mobile urgent care model, where we bring urgent care into the home. That way you don't have to leave to go to the ER or any urgent cares. I have a team of nurse practitioners that are able to diagnose, treat UTIs in the home. And I've been in the emergency care setting for about 25 years.
Amazing. And I know you guys do so much more, but today, we're talking about UTIs, and because you bring so much to the table, I have to pick your brain on a stat that I saw right before this conversation. I saw that over 8 million doctor visits each year are in the US, and they're especially common and more dangerous in older adults when it comes to UTIs. Like, why do you think that is?
Right, absolutely. Older adults, they're more vulnerable because they have a weaker immune system. Infections progress faster because of the weaker immune systems. They have empty bladder emptying issues, like prostate problems in men, and then incomplete emptying in women are very common, as well as incontinence. Catheters and other medical devices can harbor more bacteria than when you do not have these catheters. And then chronic conditions like diabetes, kidney disease, they make it harder to fight infections.
So, what are the warning signs? I know there's so many of our listeners out there who are caregivers and patients themselves. What are some of the symptoms of a UTI that people should never ignore?
Fantastic that you would say that. So often the red flag symptoms are burning with urination. Everybody knows that one. Burning with urination, frequent urgency with urination, cloudy, foul smelling, or even bloody urine. And those are the classic signs. However, in the elderly, we see the symptoms that are very atypical. Instead of burning or urgency, you get older adults show confusion, agitation, weakness, and even falls. And these are very important not to miss because infections can silently spread to the kidneys and the bloodstream. And we want to catch it before it gets there.
Okay, so we have to pause and talk about this because about a month or so ago, I got a phone call from my dad about my grandma who is turning 91 in a couple months. So go, grandma.
Oh,
But everybody was so confused. They thought she had a stroke because of her symptoms. She was totally out of it, discombobulated, and just like we just thought it was a classic signs of stroke, but it turns out it was a UTI. And it really scared our family because other than that, she's a pretty healthy lady. So can we talk a little bit about prevention? Like, I know you spoke about warning signs, but if we want to go even further, like what advice do you give our patients for prevention?
absolutely. Yes. So hydrate, hydrate, hydrate. That is my number one prevention, especially in the elderly, because they tend to be chronically dehydrated, whether forgetting to drink or not drinking enough water as they used to. And so with that, you don't want to hold urine as well. You want to make sure you're emptying your bladder fully and regularly. For women, it's very important to wipe front to back because we don't want to introduce any bacteria. Also avoid harsh soaps, bubble baths, and perfume products as they can alter the pH balance. And with certain bacteria, that's the first defense mechanism is the pH to kill off those
Wow.
bacteria before they are introduced. Yeah, it's pretty neat.
I mean, I think so many of us would not have thought of like certain soaps or changing the pH. Like those aren't just things that are talked about all the time. And I know that you and your team do such a good job of like educating our families and patients in the home. And I really want to connect that with like the work you're doing here at Restore First Health, because when your team visits patients at the home, I want to know, how are we diagnosing and treating UTIs differently than what they would experience in a clinic or an ER?
Absolutely. First of all, you're in your own home. You're not around anybody that may be sick. You don't want to go in with a UTI and come out with the flu, so we're in the home. We take care of them in the home. We have urinalysis right there. We can do right there in front of the patient, in front of the patient and in the home. And then whenever we are worried about a very bad bacteria that may be not susceptible to certain antibiotics, we can send it off for a culture and treat according to that. But the most important thing is you're in your home, we can prescribe antibiotics and you never have to leave.
And I feel like there's so much out there now that shows the data about the higher healing rates and happier patients when they are in the home. So thank you for sharing that that approach. And I guess like before we close up, if out of everything we've spoke about, what would be the one key message you would want our patients and caregivers to take away about UTIs?
Absolutely. Stay hydrated. Hydrate for sure. And watch those early signs, and especially the atypical signs in the elderly. Because if we can get there and you call us early, we can prevent it escalating and you having to go to the hospital for a kidney infection or even sepsis. So call us soon, call us early, and we'll be there to take care of you.
I truly believe that. And I've heard the amazing stories that you and your team have shared with us, which is amazing. And so, really, thank you so much for sharing your expertise today. And for everyone listening, yes, and for everyone listening, UTIs may seem simple, but they can quickly become serious, especially in those older adults or those with chronic conditions. So, we want you to remember that at Restore First Health, our mission is to bring that advanced compassionate care to the home, keeping patients safe, supported, and healing. So, Jonathan, thanks again for joining us. We'll see you guys next time.
Thank you for having me. I appreciate you.